Varicose veins are a common condition, especially in Western countries, affecting up to 40% of the whole population. They are most commonly known or recognized as bulging veins on the legs, particularly when standing or even sitting, and partly disappearing, partly or totally disappearing when lying down or with elevated legs. Common symptoms are represented by swelling of the legs, itching, aching, heaviness, sensation of congestion, cramps during the night, and eventually skin changes and discoloration. No, we can deal with varicose veins with a large portfolio of different treatments. Currently, we use almost only minimally invasive techniques because traditional surgery, the so-called open surgery or stripping, is absolutely and definitely old-fashioned. I used to calling it a prehistorical surgery. Currently, with minimally invasive endovascular techniques, also cosmetically effective, we can get rid of saphenous veins or even smaller veins on an office-based practice with local anesthesia and sometimes with no anesthesia at all, using pinhole incisions instead of the typical incisions with blades, with no downtimes, immediate recovery, and patients can get back home immediately and get back to their normal daily activity starting from the day after the intervention. The TLDC is my personal patented technique, which I presented many years ago all over the world, in Europe, in Brazil, in Japan. It means transillumination endovenous laser microcoagulation. It's an extremely effective laser treatment to be used on smaller superficial veins, usually feeding thread veins. Inserting the fiber optic, a very tiny fiber optic, into the veins using only a needle, so without any incision, I can seal shut, firing the vein under local anesthetic without any scars, with excellent results, no downtime, immediate recovery, also the daily normal activities the same day. The procedure is not painful at all because it's performed under local anesthetic along the veins to be treated. And how long does it take? Depending on the number of veins to be treated, from few minutes to maximum 1 hour of treatment when I have to treat both legs. The results will be very long-lasting because once the vein is completely closed using the laser energy, it will be completely reabsorbed. And especially, not only the vein won't be any longer visible, but also the thread veins around it. Usually, most of them tend to fade away without doing any additional treatment. Otherwise, a few days or few weeks after this procedure, we can inject the thread veins using the microsclerotherapy technique to get rid of all of them.